right, Dr. Tam here. So today we are going to talk about some of our wins that we have. So follow me. Let's see what our providers have in terms of wins. Let's head in there. Dr. Byrne.
Hey, how's it going?
We have Felly here.
Hi, Felly.
So,
Hi.
How's it going?
Hey.
Dr. Byrne, we're
going
going
on?
to talk about some wins that we had. Come on up. Let's chat about it. Some wins that we have for our patients, right? From yesterday, from today. Dr. Byrne, what kind of wins do you have today?
We got a few wins from today and from yesterday. We got one patient that came in just last week, a week ago, walking in with a cane, could barely stand up, walking in like this. Within a few adjustments, a few treatments of decompression, she's up standing right, she's getting better sleep.
Wow.
And all these little things sometimes we take for granted, but once
We
it
do.
really starts to affect our life and our quality of life, then we realize, okay, something needs to be done. We can't have this keep going on in the long run. Another patient coming in, same exact reason, low back pain,
Yeah.
coming in hunched over.
Wow.
Another example, within a few weeks of decompression, no pain going into the leg anymore, and it's gonna just improve her quality of life, make her sleep better, function better throughout the day. Just when it comes to putting on your shoes, taking off your shoes, when we can't do that anymore, it's like, oh my gosh, I didn't realize how much
It
this
really affects us, right?
us. Mm-hmm.
Yeah.
Most definitely.
Dr. Byrne, thank you for sharing your
Oh,
wins.
more than welcome. More than
Yeah.
welcome. Mm-hmm.
Come on back. We got more wins back here. Felly,
Hello.
Robin's our
Hi.
nurse practitioner. So
Hello.
Robin, share with us about some of the wins that you have seen from yesterday and today.
I had a patient yesterday who came in with some severe back pain. I was able to tell her that I was able to relate to her because I had some of the same experiences that she, and that I agreed with the technique that she was about to use, that of Dr. Byrne recommended, and that I felt that she would have great outcomes from them.
You know, this patient we talked about just this morning, right?
Yeah.
And she only had one treatment.
Right.
And with the one treatment, this patient doesn't want like back surgery, doesn't want to have anything invasive that was done. Do you find that to be a lot of people's fears when they come in?
Yes, they
Yeah.
are, because back surgery is often 50-50, whether you're successful or not successful, and there is a long road to success, and it also depends upon how you respond to the surgery and how you respond to what you need to do to recover. This also, our treatment here, also, you do have to participate in your recovery, but it is less painful, less invasive, and it often brings good responses and reactions.
That's awesome. Thank you, Robin. Thank you. All right, so these are our laser therapy machines, right? So we have two of them in here. Now, people a lot of times will ask us, Dr. Tian, why do you have two? The reason why we have two is because sometimes someone needs to have their cervicals get lasered, and at the same time, their lower back lasered as well. Because also they might have two knees that have to be lasered, left and a right knee also. Now we have Alex over here. Alex is our case manager here in the office, and she is a lot of times your first touch to the experience of the office. Alex, what type of wins have you seen so far?
I've seen multiple wins actually. Getting to know the patient and absolutely understanding what they're coming in for, making sure that we're seeing the value in their life and making sure that they're getting the care that they need. I've actually seen mainly neuropathy patients that come in. Sometimes I'll get phone calls stating that they're feeling a whole lot better, and that they're absolutely loving the care that we offer them, and they feel that we understand them and that we actually listen to them.
Would you say, Alex, that one of the most important things is that patients are misunderstood when they talk to their doctors? Like their doctors don't really understand them.
Absolutely. I actually had a patient who came in he was completely in pain, and he had a very big wall up between him and I had to break that wall in order for him to understand that I'm here to help him. He told me that he felt like every single chiropractor and doctor that he visited, they brushed him off. He said that all he felt like they did was just prescribe him a bunch of medication and earn money off of him. So when he came here, he thought the same thing, but now that he's getting the care that he needs, he feels like he's being heard and taken care of.
Awesome, Alex. Thank you so much for your experience.
Of course.
So on top of the 2 laser machines that we have here, we also have 2 other ones in the other room as well. So why don't you guys come over here? Check out this room. We also have 2 other lasers on this one. And well, sometimes people are in that room, sometimes patients are in this room. Depends on which room. Those of you who have been patients, you've probably seen both rooms. And whether it's this one or that one, we don't know which one you're gonna end up with. But this is a special room that I'm about to show you that a lot of people have not seen yet. And this is going to be our IV therapy room. Something that we'll be starting within the next 2 weeks is back here. This room is specifically built out for our IV therapy system. And when you look in here, it has 3 chairs, right? It has a couple of the IV poles that we have here, 3 IV poles to support everyone that is needing their IVs done. We will be having IVs in terms of performance, for weight loss, immunity, hydration, for beauty as well. And people will be able to experience that really like in the comfort of their own home. We want to make this as homey as possible.